Autonomics is one of the most high-yield topics that we're going to go over in this course. Up until now, we've talked about dysfunction in terms of muscle, bone, attachment, insertion, and things that you can physically palpate. But this is completely different. We're going to be talking about visceral and organ dysfunction and relating that to a somatic dysfunction. So the important concept that you need to be able to do is relate the somatic level of where you may find a dysfunction and relate that back to a visceral dysfunction or an organ dysfunction. You need to be able to flip that backward as well. If there is some sort of visceral issue, you need to be able to anticipate where you can palpate that as a somatic finding. The visceral organs are innervated by the autonomic nervous system, and the autonomic nervous system can be divided into two sections. You have the sympathetics and the parasympathetics. We're not going to go over what happens to each organ for sympathetic and parasympathetic outflow, but just remember sympathetics are your fight or flight response, and parasympathetics are more rest and digest. So when you're thinking parasympathetics, think pizzas on the tie. So to start off with, we're going to go over the sympathetic levels. So the way that I'm going to divide this out is I'm going to write out each level and what structures are innervated by it, but I'm also going to draw a picture in the same color to help it stick a little bit better. So we're going to start off with T1 to T6. In this range, you're going to think of the head, the neck, esophagus, the heart, and the lungs. So as a picture, we have the head, the neck, the esophagus, the heart, and the lungs. So the next level is going to be T5 through T9. When you think of a ganglia here, think of the celiac ganglia. The organs that are going to be innervated for this level include the stomach, duodenum, the pancreas, the liver, the gallbladder, and the spleen. So to draw that out, we have the stomach, the liver, the gallbladder, the pancreas, and the spleen. And finally, the duodenum. So the next level, we have T10 and T11. When you're thinking of ganglia here, think of the superior mesenteric ganglia, and for organs being innervated, think about the remainder of the small intestine after the duodenum, the cecum, the appendix, the ascending colon, the first half of the transverse colon, the kidneys, the upper ureters, and finally the gonads. Now you're thinking T10 and 11 for the gonads. Why is that? Male gonads are so low. Why is it innervated by T10 and 11? So think about embryologically, the gonads begin up in the abdomen around T10 and T11. Throughout the development process, the gonads descend into the scrotal sac, whereas the ovaries just stay where they are. So remember, gonads is strange, T10, T11. So drawing that out, we have the remainder of the small intestine. We have the cecum, the ascending colon, and the first half of the transverse colon, as well as the appendix. You also have the kidneys, and the upper ureters. So now the final level, T12 through L2. When you're thinking of a ganglia, think of the inferior mesenteric ganglia. When you're thinking of structures that are going to be innervated here, think of the rest of the colon, the lower ureters, the bladder, the prostate, and the rest of your sex organs, excluding the gonads. So drawing that out, we're going to have the rest of the colon, the lower part of the ureters, the bladder, the prostate, and all of your sex organs except for the gonads. So you're looking at the picture. One thing that you may realize is that everything is innervated in a top-down approach. So you have the head and neck, the upper area. You have the epigastric area, the middle area, and so on and so forth. The only weird part is going to be the GI tract. So you have to think about where exactly the food is passing along the tract as you're eating to think about innervation levels. And remember, the only really weird one is the gonads. So now we're going to transition over to the parasympathetic levels. This section is going to be a lot easier than the sympathetic levels because there's only two options. We also don't have to suffer through any more drawings. So the two options that we have are the vagus nerve and the pelvic splanchnic nerves. So how exactly is this divided? One line. Right there. Everything above the line will have vagus parasympathetic innervation. And everything below it will be pelvic splanchnic. And that's it for parasympathetic. Super easy. So how are we going to be treating these? Well, when you're doing autonomic treatments, the main thing that you have to remember is your treatment will not increase outflow. What it's going to do is decrease the innervation facilitation. So when you're doing the treatment, you're trying to decrease the sympathetics, or you're trying to decrease the parasympathetic outflow to the area. So for your treatment, if you're trying to down-regulate the sympathetics, you're going to try paraspinal inhibition. And the most common paraspinal inhibition that students know is rib raising. So if you are trying to decrease sympathetic facilitation to one of these organs, you go to the level and you perform the rib raising treatment. You can also perform a direct ganglia release. The ganglia are the ones that we outlined. So direct ganglia release. So how about parasympathetic? It's going to be different if you're trying to treat the vagus or the pelvic splanchnics. So vagus, you're going to want to treat the OA. And for the pelvic splanchnics, you're going to want to treat the sacrum. When you're treating the sacrum, you're going to think of inhibitory techniques. So you can think of sacral rocking, and facilitation maneuvers. So the autonomics, the important thing that you have to know is being able to relate the visceral dysfunction back to your somatic level finding. You also need to be able to flip it and say if you find a somatic dysfunction in a certain area, they might be trying to point you toward some sort of visceral dysfunction. So we went over all of the sympathetic levels, suffered through another picture, and then talked about the parasympathetics and the treatment style. And that's OMM for Autonomics.